So for my honors option project, I wanted to talk about the physics behind EKGs. So before I start the main portion of this presentation, I want to briefly talk about the physics behind the heart. And so when looking at a heart, when it's going through a heartbeat, it's a lot like a complex circuit, like we talked about in class, starting at the SA node, or what's also referred to as a pacemaker cell. And different depolarizations or repolarizations that occur during this process are electrons that are moving through the circuit. And so on the bottom right, I made a little complex circuit diagram to kind of explain this more. And so the SA node is like the battery because it provides the charge that the heart needs to conduct for it to heartbeat. And so going straight from this SA node splits off into three different parallel circuits or three different parallels. One going behind the heart to the left atrium to a place called Bachmann's bundle, which causes that portion of the heart to contract. There's one that stays in the right atrium with the SA node that causes the right atrium to contract. There's also one that goes down to the AV node, and that after that goes to the bundle of His, where it then splits into two separate parallels from that, one going to the left ventricle and one going to the right ventricle. Ultimately, all those different parallels coming back together, going back to the SA node to end one heartbeat and to eventually start another as the SA node brings another charge to the circuit. So what is an EKG? An EKG is also referred to as electrocardiogram. This is a tool used for monitoring one's heart rate and heartbeat patterns using a voltage versus time graph. And this typically consists of three different leads going using a negative node to a positive node at different parts of the body. And so these consist of one going from the right arm to the left arm, one going from the right arm to the left leg, and one going from the left arm to the left leg. And so how these leads work, so when positive charges are moving towards the positive electrode in the lead, these provide a positive voltage to this voltage versus time graph, which is also referred to as depolarization. Or when positive charges are moving away from the positive electrode, these provide a negative voltage, which is shown on EKG as a repolarization. And so for lead one in particular, I'll only be talking mainly about lead one, lead two. But for lead one, we start out at the SA node. Since these are going towards the positive portion of the lead, these will cause the depolarization at the P portion of the electrocardiogram. And then as you go down to the AV node into bundle of His, the different impulses spread out throughout the heart. And so going to the left, as you can see, they're going to the negative portion of the lead. This causes that slight repolarization you can see at the Q portion of the electrocardiogram. And then as you continue going counterclockwise through different impulses, they gradually go more to the positive, causing repolarization at the R, but also going slightly towards the negative to allow it to go back to that neutral state around the ST segment area. Then you also have one more contraction at the left ventricle area, going towards the negative portion, causing the T portion of that of the electrocardiogram. And so lead two is very similar with starting at the SA node again, going towards a positive, causes the P. Then you have this portion of the bundle of His impulses going towards the negative, which causes the repolarization at Q. Then you have these going again in the counterclockwise motion, causing the S wave. Then you also have this last portion of the impulse at the bundle of His going towards the negative, which causes that repolarization again at the S portion of the wave. And then again, you have the electrical impulse here causing the T wave since it's going that way. And so there's two main arrhythmias I want to talk about in this presentation. Firstly, I want to talk about atrial fibrillation. This occurs when EKG waves are quivering. And I kind of show that on the bottom with the different EKG readings going from the normal on the left to the atrial fibrillation one on the right. And so this is caused by discoordinated signals coming from different ectopic cells or pacemaker cells in the right atrium to the AV node. And this is consists of multiple reentry circuits going through it, causing a lot more contraction to occur in the atria and causing atria to contract so fast that the ventricles can't keep up. This causes blood to start pooling in the atria instead of moving into the ventricles to be pumped to the rest of the body. And then another type of arrhythmia is ventricular tachycardia. This consists of when the EKG has only R waves. And this is because the signal is originating in the ventricles due to rogue ectopic cells or pacemaker cells like the SA node that appear in the ventricle and become the pacemaker of the cell. And this causes the heartbeat to go so fast, or way too fast, going up to 300 beats per minute. And some data behind the ventricular tachycardia I found was Creighton University. They conducted a study looking at 35 different patients with prolonged ventricular tachycardia, as well as other ventricular-based arrhythmias. And if you want to look at that more, I have a link to it right there. And then what it showed was patients generally had an EKG result like the one on the right. As you can see, kind of only having that R wave going up and down, up and down, up and down after ventricular tachycardia occurs. So in conclusion, the heart is a lot like a complex circuit. The EKGs detect deflections of voltage across the heart through three different leads, voltage versus time-like graph. And EKGs can find different arrhythmias, including atrial fibrillation, which is when different signals sent to the heart disrupt heart rhythm, and ventricular tachycardia, when cells and ventricles initiate heart circuit and cause a rapid heartbeat. Here are my sources, and thank you for listening.